Welcome to Lecto. Today we are going to discuss different functions of the vitamin A and the disorders that are actually related to the vitamin A deficiency. So first of all, we will revise the different forms of the vitamin A. So if you see here, as we have discussed in the previous lecture, that there are different forms of the vitamin A. You can say that retinyl esters, okay, retinol, that is the alcoholic form. Retinyl ester break into the free fatty acids and the retinol. Okay. Third one is the retinol, that is the aldehyde form. Retinoic acid, that is the acidic form. Okay. And last one is the beta carotene. So actually, when the beta carotenes break down, it will convert into the two molecules of the retinol. We have discussed all these different forms. Okay. First of all, if we discuss the six major functions of the vitamins A. First one is the visual cycle. Visual cycle. So actually, vitamin A is very much important in the vision, specifically in the dim light. How? Actually, 11 cis, here is the 11 cis retinol, that is the form of the aldehyde. It will combine with the opsin, that is the protein opsin, that are actually present in our eye. 11 cis retinol combined with the opsin, and ultimately you will see the formations of the molecule, and that is rhodopsin. Now this compound is very much important in the dim light. Okay, when someone goes towards the bright light, then what will happen? Then suddenly rhodopsins break down. Okay, suddenly rhodopsin break down into the all trans retinal along with the opsin again. That's the most important thing. Okay, that when someone goes towards the bright light, rhodopsin break and it will convert into the all trans retinal and the opsin. Okay, when that person come back again into the dim light, then we also require the rhodopsin. That is, rhodopsin is very much important in the dim light. Again, from the all trans retinal, you will see again formation of the rhodopsin. But how? So if you see here, all trans retinal convert into the all trans retinol, and from the all trans retinol, you will see it will convert into the 11 cis retinol, and from the 11 cis retinol, it will again convert into the 11 cis retinol, and 11 cis retinol combined with the opsin, and ultimately you will see the formations of the rhodopsin. That is actually the important component in the dim light. So actually rhodopsin formation depend on two most important components. First one is the presence of the vitamin A, and second is the intensity of the light. If the intensity of light is increased, then breakdown of the rhodopsin will also be increased. So ultimately, if the intensity of light is low, then rhodopsin breakdown will also be low. So it actually depends on two components, vitamin A and the intensity of the light. So this is actually the process that actually happens in the light. If you see the deficiency of the vitamin A, then there is no formation of the rhodopsin, and that person will not be able to see in the dim light, and that is called night blindness. That person cannot see in night, or you can say nyctalopia. Okay, second most important functions of the vitamin A is the growth. Vitamin A is very much important in the growth of the bones. Bone growth man is actually mediated by the vitamin A. Okay. Next is the metabolic role. Metabolic role of the vitamin A. Vitamin A is very much important in the synthesis of the glucocorticoid. Okay, that is glucocorticoid hormone, and it is also very much important in the synthesis of the glycogen from the lactate or glycerol. That is actually called gluconeogenesis. Okay, synthesis of the glycogen from the lactate and the glycerol, and ultimately formations of the glycogen. That process is actually called the gluconeogenesis, new formations of the glycogen from the lactate and the glycerol. Okay, and last is the vitamin A is actually important in the proper working of the mitochondria. So mitochondria function is also mediated by the vitamin A. Okay, next if we discuss the role of the vitamin, and that is reproductions. Reproduction. So vitamin A in the form of the retinol and the retinal. In the form of the retinol and the retinal. That's the most important thing. So vitamin A in retinol and retinal form is very much important in the reproduction. In case of female, it actually prevents the loss of the fetus in the pregnancy. That is the most important. Prevent loss of fetus in case of female. And in the male, you will see vitamin A is actually important in the spermatogenesis. Spermatogenesis. Here is another important functions of the vitamin A. Next, if we discuss the epithelium, maintenance of the epithelium is done by the vitamin A. Okay, so actually vitamin A maintains the epithelium and the mucus secretion. When you see the deficiency of the vitamin A, then you will see that the epithelium become dry, stratified means the formations of the different layers, and you can say keratinization of the epithelium, and ultimately you will see the different ophthalmological and dermatological disorders. So it's mean that vitamin A is very much important in the proper maintenance and the differentiation of the epithelium and the proper secretions of the mucus from the epithelium. And last is the preventions of the chronic diseases. Vitamin A in the form of the beta carotene, that is very much important. In the form of the beta carotene help or prevent from the different chronic diseases like heart diseases, okay, heart diseases, lung and skin cancer, or it can also prevent from the cataract and the macular degeneration. Actually macula is present in our eye, so macula can become degenerate in the absence of the vitamin A. So actually beta carotene prevent from the different chronic diseases, heart, lung, skin cancer, cataract and the macular degeneration. Basically beta carotene has antioxidant activity, or you can say it enhances the immunity of our body. That is very much important role of the beta carotene. So here are basically the 6 functions of the vitamin A. If we discuss the different disorders that are actually related to the vitamin A deficiency, we are going to discuss. First one is the ophthalmic disorder. First one is the ophthalmic disorders. So in the ophthalmic disorders, we are going to discuss three most important disorders. First sign of vitamin A deficiency, that is the night blindness. Night blindness, or you can say nyctalopia. Nyctalopia. Because vitamin A is very much important in the production of rhodopsin. When there is no vitamin A, then there is no production of the rhodopsin, and ultimately that person will not be able to see in the dim light, and that is called night blindness or nyctalopia. Okay. Second condition is the xerophthalmia. That is the second condition. Xerophthalmia is basically, zero means dry. So it is actually the dryness of the cornea and the conjunctiva of our eye. That is called the xerophthalmia. So actually eye become dry. Then in that situation, the cornea become ulcerate. Ulcerations can happen in the cornea because when it touch to the eyelids, then ultimately chances of the formation of the ulcer happens in the cornea, and ultimately you will see the formations of the opaque scar formations in the cornea, and that is actually called the Bitot's spot. Bitot's spot. That is actually different conditions in these xerophthalmias, dryness of the cornea and the conjunctiva. And last one is the keratomalacia. It is actually happens in first year of life, and in this case you will see the cornea become dull and the insensitive in the keratomalacia, and ultimately you will see the necrosis of the cornea. Here are basically the three most important conditions in these ophthalmic diseases. Next is the dermatological disorder. So actually vitamin A is very much important in the maintenance of the epithelium. When there is a deficiency of the vitamin A, the most important condition you see is the scaling of the skin. That is the first condition. You can easily see that the epithelium can easily scroll out or the scale from our skin. And next is that is xerosis, dryness of the skin, and the formations of the different pustules on the skin. That is actually dermatological disorder. So basically, if you see the acne, or you can say psoriasis, so vitamin A, especially in the form of the retinoic acid, help in the treatment of the acne and the psoriasis. That's the most important thing about the retinoic acid and its different derivative, that is retinol. So after that, retinoic acid is actually teratogenic. It creates different abnormalities in the pregnancy. So that's why pregnant women should not take any retinoic acid, because it is teratogenic and it creates abnormalities in the baby. Okay, that is contraindications in the pregnancy, that is retinoic acid. Okay, next is the genitourinary disorders. So most important disorders is the kidney stone. And in the kidney stone, you can say that the epithelium, you can easily see the epithelium in the urine. So if you see, here is the keratinized epithelium. So around the keratinized epithelium, you will see the formations of the substances or accumulations of the substances. that are actually involved in the formations of the kidney stone, oxalate, etc. And next is the defective dentine. So actually three most important component of the tooth is the first one is the first component. If you see here is basically the teeth. So in the teeth, the first component is the enamel. That is the topmost component. Second component is the dentine, and last component is the pulp. So here are basically the three components: enamel, dentine, and the pulp. So when you see the deficiency of the vitamin A, then in the formations of the enamel formation will be disruptive, and ultimately you will see the dental caries. So vitamin A interfere in the proper formations of the enamel, and ultimately you will see dental caries. And last one is the pulmonary disorder. So in the pulmonary disorder, you will see loss of cilia. Actually, in normal our respiratory tract, you will see the presence of the cilia. When the cilia loss, then what will happen? Then the chest infection will become common in that person. So here are basically the 5 different disorders that are actually related to the vitamin A deficiency. So this is all about the different functions and the deficiencies of the vitamin A. If you still have any question, you may ask in the comment section. Thank you so much.